Good morning, everybody. Good morning, Madisonville, Hopkins County. Judge Executive Jack Whitfield with you today. Mayor Kevin Cotton. We have Dr. Deanna Ashby with the Hopkins County Schools and Denise Beach, the director of the Hopkins County Health Department. But more importantly, today, for the last year, you've heard me say good morning, Brecken. So today we have Brecken with us. Can you say good morning, everybody?
Oh, bye.
So this is my great nephew, Brecken. He is 3, and Brecken made a special video for me that perfectly illustrates 2020. So I think we can get that video played.
As you see, it kind of started out really easy and as planned, and then everything just kind of fell apart, right?
Yep, everything started out fine and then went downhill from there, didn't it, Brecken? Can you say yep? Yeah.
Well, Brecken, we are excited to have you here with us today. Is there anything else you want to say?
I'll go with see.
All right. Well, we definitely are excited to have you, and you have been the highlight of our shows for the past year, as your uncle has said. And but you definitely have illustrated to everybody exactly how we have felt throughout the past year.
Can we play that one more time?
Yeah, just
I
one
love
more
that
time.
video.
Are you watching it?
And I should say that no harm was done to any children during the filming of this video. He was just fine. Kids are tough and resilient.
All right. Well, we do have some guests with us, and we'll start off with our COVID numbers. And since we have Denise Beach here with the Health Department, Ms. Beach, if you don't mind to kind of go over the numbers and where we're at, and then I know that you have some other things that you'd like to talk about as well with the vaccines. And
Yes, thank you. Good morning, everybody. Our numbers, we have 3,865 currently. That's the number of COVID cases that we have documented. We have 127 Hopkins County deaths. 3,537 have been resolved. We are now switching to going weekly with our numbers. On Monday, we will post them by close of business on Monday instead of posting them every day as our focus shifts to vaccination efforts. We will still be doing isolation and quarantine of positive cases and working with them and working with businesses who have employees needing slips when they are quarantined. But we're going to start focusing more on vaccine efforts, and that's what we've been doing. We are now in the orange in Hopkins County, which means we have under 25 per day per 100,000 cases, and we are really excited about this. We feel like it is given us some new hope for 2021. And we know this is a combination of the bad weather and people staying home more and the vaccine efforts that we've had in our community. Right now, we are at about 1,500 vaccines, 15,000, vaccines that have been given between Baptist Health Madisonville and the Hopkins County Health Department. We'd like to thank Baptist Health and their pharmacy department. They've done a wonderful job. They're doing about 200 vaccines a day, new vaccines per day, and then boost doses on top of that. They have just been awesome at working with us on this, and we are now doing 200 per week. They are a regional vaccinator, and therefore they are receiving more vaccine, and we're so happy for the partnership. We would like people to know that if you are vaccinated and it has been 14 days since your last vaccine, you will not be quarantined for at least 90 days if you are around someone who is positive for COVID-19. We hope that that will be extended. People are like, well, why if the are you only giving 90 days? Because we just don't have enough data yet. We're learning as we go, but we do expect it to continue to be extended. And we're thinking this will probably need a once-a-year booster, but it just hasn't been around long enough for us to know for sure. We have not seen any real problems from the vaccines. The main thing we're seeing is a sore arm. We also have people complaining of being fatigued, having chills, achiness, some mild flu-like symptoms after the vaccine. Most people don't even have that. They just have the sore arm and maybe a little fatigue. But the bottom line is this is a good immune response. The only thing we really worry about is a serious allergic reaction called an anaphylactic reaction. And we keep people around for 15 minutes after their injection to make sure they're not going to have that. But we have had no real problems with the vaccine so far. Everybody has been doing well. We're giving Moderna at the health department. The hospital has been giving Pfizer. And the health department has now requested that we become a Johnson & Johnson vaccinator also. The good thing about this is it is a one-dose vaccine, and it will be very helpful for populations that might be lost to return. So some high-risk populations, we're going to use our new van and go out into the community, hopefully in some areas that we can get some people vaccinated that would not come in for a vaccine. We have not received the one dose yet, but we are on the list, so hopefully that will come soon. We want to remind everybody they still need to wear their mask. They still need to do social distancing. Still, there is the studies are out on whether or not you can have a subclinical case and pass this along. Wearing the mask is just a small thing you can do to help others, and we greatly appreciate that. We hear so many times, well, if I don't want to wear a mask, then I'm taking that risk. But in reality, your mask protects other people more than it protects you. So just think about everybody else. We appreciate those who have consistently done this. One thing we're still seeing is that we'll have a whole family or a whole group that has been exposed to this, and it'll be from somebody that says, well, I've had a sinus infection or allergies for 2 or 3 days, but I didn't feel that bad, so I went ahead and went to this event, and then the next day I got really sick and I got tested for COVID. So if you have sinus problems or allergy problems, please think COVID, consider testing, and don't go and expose all of your family and friends while you have that. We, at the health department, we have now started 1C. That doesn't mean we can do everybody in 1C, and that's the same with the hospital. 1C is everybody 16 and over that has chronic illness, or anyone 60 and over. And it also has essential workers. And I know the governor has announced several times that we're on 1C, and we are, but we're having to do it in sub-tiers because we're just not getting enough vaccine to do every essential worker and every 16-year-old plus in Hopkins County. So we're still concentrating on 60 plus because 90% of deaths from COVID are in the 60 plus age range. But we will be, as we have vaccine left at the end of days or at the end of the week, we will be moving into those 1C essential workers, probably not going to facilities. We are going to start just incorporating COVID vaccination into our health department clinic. So you can look on our website at hopkinscohealthdept.com or our Facebook page. You can also schedule your vaccine at the hospital on scheduleyourvaccine.com, or you can call and schedule at 270-825-7330. And others in the community, some pharmacies and things, will be advertising and having vaccine too. Vaccine works. That's how we're in the orange now, and we hope to continue that. And we hope to be back in school very successfully and back in college very successfully for this. And we'd like to thank our volunteer RNs from Madisonville Community College and our RN from our Board of Health that helped us do a big vaccine clinic last Friday for 70 plus. That has been amazing, the support we've received from them. So thank you all so much.
So it's good that the news for the last really month and a half has been mostly very positive.
Yes.
The vaccines are going well, both at Baptist and the health department and other places. We're starting to get a good percentage vaccinated, but we still have a long ways to go. And we're now entering into, I think 1C is the largest tier of vaccine candidates.
It's the largest tier, and it especially is a tier that still has high-risk groups in it. When we get 1C done, we're down to 40 plus and 20 plus that are very low risk for serious consequences from COVID-19. So when we get 1C done, we're going to have a great part of the battle won.
Well, that'll be great when we get to that point. That'll make us all, I think, a lot more comfortable.
Absolutely. And, you know, one of the things that we are seeing is that the governor has started to release some of the restrictions and allow to increase the capacity in our businesses. We saw this week that he's opened it up for pretty much most businesses to go to 60% where they were at 50%.
Right. And I know somebody's going to ask about other restrictions because some other states have just removed all of them. And as far as I know, there's been no talk of that yet from the governor's office.
We haven't heard anything, but we have heard from our superintendent of Hopkins County Schools, Dr. Deanna Ashby. There's been some new news that's been coming out, and we're back to 4 days a week. And that's a really exciting thing, I know, for a lot of folks. I know for me to get my son back in school has been really exciting. But there's also some other things that are going on in Hopkins County Schools. And so, Miss Dr. Deanna Ashby, how about you give us your input?
Thank you. And I just want to say how excited I am to meet Brecken. And I know his mama, she was one of our students in Hopkins County Schools. I'm very proud of her. And also I'll say about the video is don't try this at home. We always want to give that disclaimer to our elementary children that are out there. But tomorrow will mark a week that we have been back with in-person instruction for 4 days. And so far, so good. We have 72% of our students back on our campuses, and I'm just saying it is great to have kids back in classrooms. Our teachers, our principals, our district leadership has worked very, very hard to mitigate everything that we can do to stop the spread. And I think so far, and we've worked a lot, obviously, with Ms. Beach and the health department, things have gone well. And as long as we can keep a healthy workforce, I know that we can keep moving forward. I would say that my prediction would be is that we would maintain 4 days a week as long as we could. We probably wouldn't go 5 days a week because of our remote learners, which we have about 28% of students that are on remote learning. And in the past, I think the second trimester, we had about 37%. So more of our kids are coming back. So of course that would be a Board of Education decision. But we are moving forward. Our high schools have set graduation dates. Those are planned to be outside. They're even going to have a project graduation that's going to look a little different, and a prom at both high schools. And again, it's going to be different, seniors only with a guest, and I'm sure that those high school students can get all the specific information from their schools. But we are just excited that we are seeing light at the end of the tunnel, and that things are starting to move back to where we were before this started almost a year ago. I've had my second vaccine, and I know over 50% of our employees have, and so we just feel good that that is a great step to mitigate COVID. I want to share just a couple of other things that we are looking into the 2021-22 school year with online registration. And so information will be out on our website in April, so please be watching for that information. But what you can do now to prepare for that is if you do not have a parent portal account, you will need to go online and set that up. You can get that information from your child's school or from Hopkins County Schools Central Office. Our number is 825-6000, and we will be glad to help you. Registration for kindergarten students and new students will look just a little bit different, but again, just watch our website for all of that information. We also plan on having a virtual option for next year because we will probably still be dealing with some fallout from COVID, and so more information will be coming out about that as we get more guidance from the state. Lastly, very important, I want to share about our food service program. And I'm just so excited to say that we have continued for almost a year now to feed our students. And even students that are not enrolled in Hopkins County Schools, if you're between the ages of 2 through 18, you are also eligible for breakfast and lunch. So we have updated some of our information. So starting today, remote-only learners can pick up their meals at any of our schools between 9:30 and 12:30 p.m. or during late pickup at Earlington, Grapevine, Hanson, Madisonville North, and West Hopkins from 2 to 5:30 p.m. That is meal pickup for remote learners only. All of our other students, of course, are receiving their meals while they're on campus 4 days a week. But on the day, Wednesday, when we're not in school but are learning virtually, they can pick theirs up at any of the community stops. So I know this is a lot of information, but you can find all of this at www.hopkins.kyschools.us/food service. And so just excited about that. And thanks to the judge and to the mayor always for allowing us to be here and to say thank you to the community and for all their support through this with Backpack Blessings and the donations that they have made. But just to be able to share about the great things happening with Team Hopkins.
Sounds like everything's going well. I know yesterday I had the opportunity to read to a class of first graders at Earlington Elementary and did that over Zoom. But the class looked great. Everybody was, separated out and looked like they were being very safe. But when I asked if they were happy to be back in school, every one of them raised their hand. They were very glad to be back with their friends and family. And I know that parents are also glad to have them back in school. One question I had heard before was, as assuming that the vaccines continue to go well and our numbers drop and people get more comfortable, can the children come back into class just at any point, or if they've signed up to do remote learning, do they have to wait for certain opportunities to get back into in-person class?
So that hasn't changed from the beginning. Anyone who is currently coming 4 days a week, if something happens and they decide to opt out and to go virtual, they can do that at any time. However, because of rearranging our entire buildings, turning them inside out, and making sure we have enough room for 6 foot minimum when children are taking their mask off for breakfast and lunch, then once you are virtual, you cannot come back in until the end of the trimester. So we are in the 3rd trimester, so anybody who is virtual now cannot return to in-person until we begin the next school year.
Okay. One thing that Dr. Ashby did not mention was a big announcement that came. Have you heard anything about changes with her?
Well, I've heard a few things, but I was really kind of thinking that we might hear that from her. So there's some really exciting news for you. And so why don't you kind of fill us in on what we've all heard, but maybe not everybody else has.
Well, it's just bittersweet. A lot of people think I'm retiring at the end of this year, which would be June 30th, because of COVID, and that's not it at all. COVID has been a challenge, probably the biggest challenge we've all faced collectively, but it's not about that. It's just about God's timing, and He always has a bigger plan, to be quite honest. So I've loved my 29 years in Hopkins County. I've been superintendent for 5 years, and I can tell you that I am so confident in the principals and the district leadership that we have in place that I feel like things are in great shape. We've done a lot of innovative things. I'm very proud of the team that we have together. So I think it's a good place, a good stopping place for me to close that chapter, knowing that I'm leaving it in good hands. But I am going to miss it. I've literally feel like I've been married to the school system all my life. My kids graduated from Hopkins County Schools. So I'm going to miss it a great deal. And sometimes there'll be those moments when I have to fight back the tears. But I know that we're in great shape. We have a good board. And I know we've already gotten several calls about who can apply to be superintendent and what does all that look like. All of that information will be shared on our website, but it's being handled through the Kentucky Association of School Administrators. Our board contracted with them on Monday night, and they will handle the search, so it will not go through our HR department. It will not have anything to do with us. It'll all be handled through that organization, and I wish them well, and I'm certainly going to miss them. I am going to stay on the sub list because I want to be able to get that booster shot, Denise.
All right, well, congratulations, and I know you'll miss the school system, and the school system will miss you as well, but congratulations on your upcoming retirement.
Thank you.
And we appreciate you being willing to come on and share with us throughout this past year what's been going on in Team Hopkins and how the schools have been affected. And again, we just congratulations to you, and we truly do appreciate all of your input throughout this past year.
Yep, so, Mayor, we've been doing this for almost a year now. I don't remember what day we started when you and I and Director Beach were up here to talk about the first case we had in Hopkins County, but it's been almost a year.
It has been almost a year.
And I don't know about you, but now that it seems like things have calmed down a little bit, I don't know that I feel the need to do this regularly now.
Yeah, I think that kind of where we're at is if there is information that needs to be sent out or an opportunity that we can share with the community, things that are going on, then we can always put out a notice ahead of time to let everybody on social media know that we'll be having an update. And at that time, we can come back and have those updates. But I agree. After a year of doing this, I know Miss Sarah Lutz will be extremely excited that she can do something different on Wednesdays. And but she has been instrumental, and so has our entire IT department, making sure that we're here, that all of our equipment is up and running, and that everything is running smooth. So it was and in the beginning, we kind of had that running joke of our Kenneth and our James, but Tim and Nick have done a fantastic job, and we really appreciate all that they have done for us during this time as well.
Yeah, and the city support staff are putting all this together. You know, across the street every week we do this, and it's been really good. And I think it's been good for us to come up and talk about it, especially the changes as they were happening. We're just not seeing those changes now, but certainly if things change, if the variants explode, or there are announcements made in regards to restrictions or other things, we'll get back on here and do our best to let everybody know.
Absolutely. So I think Miss Sarah actually has a few questions.
Yeah, we just have one so far this morning, and Denise, they're asking if you could repeat the numbers for today and how you're going to be putting those out weekly again.
Okay, the numbers are 3,865 total cases, 127 deaths, 3,537 resolved, and we will be putting them out weekly on Monday. They will be on our Facebook page by the close of business, and we close our business at 4:30.
So if my math is correct, that's 275 cases, new cases over the last month, which is certainly better than it's been. I think right now we're seeing the fewest number of new cases since, I believe, September.
September, yes.
So that's a good trend that we need to continue until we get down to where there's just nothing left. And you can see that Brecken gets his energy from his uncle, because we're both sitting there spinning our chair. He spends a little bit more than I do, though.
So Brecken, do you have anything else that you would like to say to everybody?
I'll go back.
Hey, can you say have a good day? No? Can you blow a kiss? Say bye-bye?
See you later.
Okay, he's not going to say nothing. I'm going to turn you around then.
All right, so until
Brecken's done, so I guess we ought to be.
until we have any additional updates, we appreciate everybody tuning in and being a part of our updates here for the coronavirus. And please stay safe, wear your mask, wash your hands, use hand sanitizer, and
Let's get this done and over with.
continue to remember those that have lost loved ones during the coronavirus.
Thank you.